Good evening everyone, my name is Helen Pritchard. I'm the Head of Social Sciences and the lead teacher for Health and Social Care at school. I'm just going to give you a brief introduction to what studying Health and Social Care in the sixth form is like. Many of you may already have children who study Health and Social Care at Key Stage 4. They will have some idea of the kind of content that we're going to be following. It is not a requirement that you have studied this at Key Stage 4 in order to do this in the sixth form. So the question I get asked a lot is, what is health and social care? And I like to break it down into the two sides. We have the area of healthcare and what it actually means to be healthy. And I think if you have a look at the slide on the top left corner, you can see people who are obviously physically suffering from some area of poor health, whether it's ill health, physical pain or a physical disability. But health is much more than that. And as the other slide shows, we can see people who are upset, stressed, going through difficulties in relationships, and those factors feed into our health. So the course focuses on what we call a holistic approach to the study of health, where we focus on 4 areas: the physical health of our bodies, the intellectual health, our ability to learn and concentrate, our emotional health and our feelings, and our social health, because the people we have relationships with around us have a massive impact on our development. The other part of the subject of study is the area of care, and for the benefit, for the purposes of how we study this, we look at the 3 areas that the care sector generally focuses on: the care for the elderly, care for children and young people and their families, and care for adults and children with physical or learning disabilities. We run a BTEC National Health and Social Care as 2 separate qualifications. You can study this as a A-level equivalent, 1 A-level, and that's called the BTEC Extended Certificate, and requires you to study 4 units of work over 2 years. And as you can see, units 1 and 2 are externally assessed through a written exam, and units 5 and 12 are internally assessed, and they are coursework-based assignments where you would explore within case study scenarios how individuals have health and social care needs and how they are met. We also offer the ability to study health and social care as a 2 A-level option, and this is called the diploma. You would study the same 4 units of work as the extended certificate, plus an extra 4, which are in the bottom half of the table. And you can see that out of those 4, 3 of them are coursework based, and 1 is an externally assessed assignment, although that is based on a pre-seen magazine or journal article where students are required to do some research and prepare answers to the questions, and then they will go into the exam to answer the questions, having prepared them in the build-up to the exam. I'd just like to finish by pointing out quite an important thing, that this is a vocational course, so it's very much based around what it is like to work within the health and social care sector, and is really for people who are quite interested in possibly going into this area as a career or as an area of further study. And here's some examples of the types of professions and jobs which you could follow on even after a period of further study. It is not a childcare course. We do look at areas of child development, but it's not for somebody who is really interested in working specifically in the early years of and childcare professions. So So I'd just like to say thank you for listening, and if you have any other questions, then please email me on the email address on the slide, and I will try and answer any further questions you may have. Thank you for listening. Good night.